Hello guys, welcome back to ophthalmology series. We are going to handle bacterial conjunctivitis. Okay, bacterial conjunctivitis, bacteria, conjunctiva, inflammation. Okay, in developing countries, gonococcus and corynebacterium diphtheria are the commonest type of which causes conjunctivitis. Okay, it is a contagious disease. Now coming to etiology. Predisposing factors are flies, poor hygiene, hot or dry climate, poor sanitation, and dirty habits. Okay, like flies, fomites, fingers, that only. Next, causative organisms in the order of their frequency. Most common is Staphylococcus aureus, next is Staphylococcus epidermidis, Streptococcus pneumoniae, Streptococcus pyogenes, Haemophilus influenzae, Moraxella lucaneta, and Pseudomonas pyogenes, Neisseria gonorrhoeae, Neisseria meningitis, and Corynebacterium diphtheria. Okay. Mode of infection. There are three types: exogenous, endogenous, and local spread. In exogenous, it is a commonest one. Okay. In this, it can be directly, that is by close contact, airborne or waterborne. Otherwise, it can be vector-borne, example flies, or it can be material transmission. Next is the local spread. Local spread is a infection of the lid or the lacrimal sac or the nasopharynx. Okay, or it can be endogenous, that is blood route. Example: gonococcal infection and meningococcal infection. Exogenous, local spread, and endogenous. Now coming to pathology of bacterial conjunctivitis, it shows vascular response. Okay, conjunctival vessels, there is congestion and increased permeability associated with capillary proliferation. Okay, that's why the eye looks reddish in color. Next is the cellular response. Okay, cellular response. What are the cells? Exudation of polymorpho-neutrophil cells and other inflammatory cells in the substantia propria of the conjunctiva and conjunctival sac. There is adenoid plus fibrous layer. Okay. Conjunctiva, you already know the layers of the conjunctiva. Okay, there is exudation of polymorpho-neutrophils. Okay, there inflammation is there. Next, conjunctival tissue response. Conjunctival tissue response, since there is conjunctival looks edematous and superficial epithelial cells degenerate and become loose and desquamate. Okay, proliferation of basal cells, basal layers of the conjunctival epithelium, and increase the number of mucin secreting goblet cells. Okay, first there will be inflammation. Okay, and next there will be polymorpho-neutrophils, and there is a vascular response. Next will be conjunctival tissue response. The conjunctiva will become edematous and the epithelial cells become desquamate, and there is a proliferation of basal layers of the conjunctival epithelium and increased mucin secreting goblet cells. Next is conjunctival discharge. Okay, conjunctival discharge includes tear, mucus, inflammatory cells, desquamated epithelial cells, fibrin, and bacteria. Okay, very severe inflammation cause blood-stained diapedesis of RBC. Diapedesis means RBC will come out of the capillaries. Next, severe of pathological changes depend on inflammation and causative organisms. It can be purulent. More commonly, it is purulent than mucopurulent conjunctivitis. Okay, purulent means pus. Pus is nothing but dead cells. Okay. In exam they will most commonly ask this acute bacterial conjunctivitis. Okay, the first thing I have said, it was like general, you should know it. Okay, acute bacterial conjunctivitis or acute mucopurulent conjunctivitis. Okay, acute means it is occurring in a short period of time, it is bacterial, it is inflammation of the conjunctiva. Mucopurulent means pus is produced along with mucus. Characterized by marked conjunctival hyperemia means redness. Okay, and mucopurulent discharge. Conjunctival hyperemia and mucopurulent discharge is seen here. Most common type of bacterial conjunctivitis. Most common causative organism is Staphylococcus aureus. I already said you. Other bacteria like Streptococcus, Pneumococcus, and Couchwick's bacilli, which causes red eye, and Neisseria meningitis. Okay. Predisposing factors are poor sanitation, poor hygiene, condition, hot dry climate, and dirty habits, flies. That only common things, same as that of previous one. Mode of infection is same: exogenous, endogenous, and local spread. Okay, exogenous is the commonest one. It can be direct, that is by close contact, airborne or waterborne; vector transmission by flies; material transmission like infected fingers or common towels, handkerchiefs, etc. Yeah, flies, fingers, fomites, I already said you. Local spread it is by infection of the conjunctival sac, lacrimal sac, lids, and nasopharynx. Okay, locally it will spread to there. Endogenous means it was present in the bloodstream, that is gonococcal and meningococcal infection. What are the clinical features of acute bacterial conjunctivitis? The symptoms seen are discomfort, forearm body sensation, grittiness, redness of sudden onset. Okay, these are usually present: discomfort, forearm body sensation, grittiness, and redness of sudden onset. Okay, the eye will be fully reddish in color and there will be pus. Fifth is mucopurulent discharge from the eye. Sticking together of lid margins, that is matted lid margins with discharge at sleep. Slight blurring of the vision due to mucus flakes in front of the cornea. Okay, there will be mucus flakes present. Colored halos due to prismatic effect of the mucus present on the cornea, and there will be mild photophobia. Colored halos because of mucus. Okay, there will be edematous. Next, first we will see this diagram. Okay, here this is a beautiful diagram drawn by the notes who prepared. Okay, here you can see there is mucopurulent discharge. Here is a mucopurulent discharge. There is congestion, means fully redness. Next is a matted cilia. You can see edema of the eyelid. Eyelids will be swollen, and these are the flakes you can see. Next is the petechial hemorrhage. Okay, petechial hemorrhage is present, and on the lower tarsal conjunctiva you can see papillae. Okay, when you retract this lower lid. Okay, there is a mucopurulent discharge, congestion, matted cilia, edema of the lid, flakes, petechial hemorrhage, papillae. Okay, this diagram, if you remember, you can write other signs also. Okay. Now, what are the signs you will see in acute bacterial conjunctivitis? First, there is edematous eyelids. Okay. Next, matted cilia together with a yellow crust. Okay, matted cilia with yellow crust. Remember, yellow crust is seen. Flakes of mucopus in the fornix, scantha, and the lid margin. Okay, mucopus flakes are present. That is critical sign. Next, there is chemosis, that is swelling of the conjunctiva. Chemosis is swelling of the conjunctiva. Next, conjunctival congestion, increase in the palpable fornices and peripheral part of the conjunctiva, that is fairy red eye. Okay, there is decreased circumcorneal congestion. Okay, and there is increased congestion in the palpable fornices and peripheral part of the conjunctiva. Okay, that's why it looks like fairy red eye. Papillae are fine type and may be seen on the lower tarsal conjunctiva, and petechial hemorrhages that is seen in pneumococcus. Okay. Clinical course, it is bilateral. Okay, first one eye will be affected. After 2 to 3 days, another eye will also be get affected. Peak in 3 to 4 days and cured itself by 10 to 15 days. Okay, or may pass or less intense form. Chronic catarrhal conjunctivitis. Complications are blepharitis, dacrocystitis, superficial keratitis, and corneal ulcer. Okay, remember blepharitis, dacrocystitis, superficial keratitis, and corneal ulcer. Now coming to the differential diagnosis of acute bacterial conjunctivitis, it can from other causes of acute red eye. Okay, acute red eye causes are acute iridocyclitis, acute conjunctive glaucoma. From other types of conjunctivitis, differentiated by clinical features. Okay, confirmation is by conjunctival cytology and bacterial examination of secretion and scraping. Treatment. Now coming to treatment of acute bacterial conjunctivitis. Okay, we will give topical antibiotics. Topical antibiotics like broad spectrum antibiotics includes chloramphenicol, gentamicin, tobramycin, frammycetin. Okay, 3 to 4 hourly in a day. If does not respond, then ofloxacin, ciprofloxacin, gatifloxacin, and moxifloxacin can be used. Eye ointment used at night that decreased morning sickness and provide antibiotic cover. Okay. Eye drops like gentamicin and tobramycin can be used. If otherwise, ciprofloxacin, ofloxacin, gatifloxacin can be used. Okay, 4 hourly per day. Or otherwise, eye ointment can be used. Anti-inflammatory or analgesic drugs like ibuprofen and paracetamol to reduce the pain, and orally 2 to 3 times a day. Symptoms relief of mild pain. Okay, dark goggles to relieve this photophobia. Dark goggles for photophobia. Irrigation of the conjunctival sac should be done with sterile lukewarm water, saline, or twice a day. Okay, as there is mucopus collection in the lower tarsal conjunctiva, therefore irrigation should be done. Okay, you should never bandage and never give steroids for acute bacterial conjunctivitis. Okay, no bandage, prevent flaring up of the infection, and no steroid. If you give steroid, there will be more complications. Okay, like blepharitis, dacrocystitis, and corneal ulcer. Okay, most common corneal ulcer. Next preventative measure is to risk the close contact transmission. Frequent hand wash, that is to maintain hygiene. Avoid sharing towels and handkerchief pillows. Okay, finger flies, fomites, that only. Okay, this is a very beautiful picture of signs of acute mucopurulent conjunctivitis. You can see there is less circumcorneal congestion, but there is peripheral congestion. Okay, in the tarsal region, there is more redness here, and you can see flakes in the lower tarsal conjunctiva. Here flakes are present. Okay, and there is increased congestion. That's it. See you in the next video. Until then, Jai Hind, Jai Bharat. Bye bye.